Hey there, Wellness Warriors. Welcome to the Anchor to Wellness Show, your compass in the sea of holistic health. Together, we're making waves to reclaim control of our health destiny and anchor ourselves to wellness. So whether you're seeking clarity on brain fog or ready to reclaim your vitality, you're in the right place. So let's make waves and set sail towards a life anchored in wellness. Okay, so I asked my Facebook community to send me their real questions, and guess what? They delivered. I'm not surprised. Good job. So what came back was not a list of just random health curiosities. It was a snapshot of exactly what women are carrying right now. There was thoughts about thyroid, like the confusion around that, autoimmune diagnoses with zero real answers, environmental exposures nobody's talking about, and hereditary labels that are using to shut down the conversation that's being used to do that. It's so distressing. And then there's these, there were questions about post-surgical symptoms being written off as just aging, and one woman who is actually doing the work, one change at a time, wanting to know if she's doing it right. So I'm going to answer each and every single one of these questions here today on this episode. These are questions I hear every day in my clinic, just in circles I'm in, all the things, okay? These are the questions your doctor probably didn't know how to answer, and that's not a slight to our medical community. It is just the truth. And how do I know that? Because I was there. I practiced conventional medicine for 20 years, okay? I did it. I did the referrals. I did all that. And so I know I would not have had very good answers to some of these questions, okay? And I might have said the same thing that many of you are hearing. Okay, so question number one. Why does my thyroid hormone dosage keep going up every 6 months? I started at 30 milligrams and I am now at 120 milligrams. So let's talk through this. This is one of the most important questions in all of thyroid medicine when we start thinking about that. And the answer is not that your thyroid is just progressively failing on its own. And a lot of times we hear that, well, it just gets more worn out. No, that's not what's happening. When a thyroid dose keeps escalating, that is a signal that the root cause maybe has not been addressed. You're replacing the hormone, which is great. We stop that metabolic mess. I talk about that in my book, right? But you are not asking why the thyroid lost function in the first place. That's not being addressed. In functional medicine, the most common driver of escalating thyroid hormone, when that need is going up, it's usually unaddressed autoimmunity, specifically Hashimoto's thyroiditis. And I'm not here to diagnose anyone, but this is a part of what's happening, is sometimes it's not just what's happening in the thyroid, it's something that's happening downstream. And that can be that autoimmune stuff that's starting to happen, and Hashimoto's is one of those. So that is when the immune system is attacking thyroid tissue. If that immune dysregulation is not addressed, right, that's what's causing autoimmunity. That attack continues and more tissue can be destroyed, and then that dose has to go up. It can go every 6 months, every year. It just will continue to go up usually. I will also say that Hashimoto's is sometimes hard to make sure that dose is right on track, because it kind of does depend on what is happening with the immune system and if it's being taxed in other areas, and that's a big part of that. So there's so many things that attack our immune system, and when that's happening, that immune system is reacting more, and then that's when autoimmunity usually flares more, and that's when it's harder to get the medications at the right dosage. So it will fluctuate a lot. So I often tell people the thyroid is a people pleaser. It is trying to address things downstream. It's sacrificing itself to help everyone else, just kind of like people pleasers do, okay? So it's not always just a thyroid problem. There are other root causes that I look for, and one of those is gut permeability, because that gut is where a massive portion of the immune regulation happens. A huge part of the immune system is in the gut. So that's one of the first places I will address. And then we have to talk through nutrient insufficiencies, things like selenium, zinc, iodine. Those are all required cofactors for the thyroid hormone production and that conversion, that T4 to T3 conversion. By the way, if you're not having a T3 checked, a free T3 for sure checked, you're not getting a thorough thyroid evaluation, okay? So what about other things like chronic stress, elevated cortisol? When the adrenals are doing their thing, that will suppress thyroid function at that level of that conversion and that receptor sensitivity. That's where we start getting issues with that reverse T3, free T3. Okay, so those are all things that need to be checked. And then we have to think about environmental exposures, things like fluoride, chlorine, bromide. Those all will compete with iodine at that thyroid receptor, okay? The question is not always just how high does your dose need to go? The question is, what is driving the need for more hormone? And sometimes I will push the dose because I need that thyroid to be in an optimal zone so that metabolic mess doesn't just keep spinning. And these are all completely different clinical conversations. And the thyroid panel needs to be a TSH, free T3, free T4, reverse T3, thyroid antibodies. That's a real thyroid workup. Once I get somebody kind of stable, then we can screen with TSH, free T3, free T4. That's the way I start to monitor things. So there's a difference in all of that. Okay, so question number 2, how much does your environment affect your health? Like if you have mold in your home or work, will it cause problems? The short answer is yes, environmental things definitely affect our health. It is honestly one of the most under-recognized drivers of chronic illness that I see, because we often say things like, well, my grandma didn't have this or whatever. Well, your grandma wasn't in the same toxic environment that we live in, right? There are a lot of hormone disruptors and all that. So a lot of times if someone is not getting better, I do think a lot about a mold toxicity potentially. I used to would have said, yeah, your body will just clear that mold. You're designed to do that, which is true because our bodies are designed to heal. So it is designed to get rid of that. But if it's doing 40,000 other things and trying to get rid of other toxins, it is a lot harder, okay? So mold does not just cause these allergies. Certain species of mold produce mycotoxins, and these are chemical compounds that are genuinely toxic to human tissue. They trigger immune activation, neuroinflammation, so brain stuff, mitochondrial damage, that's cell health issue, hormone disruption, and gut permeability, so that leaky gut. The symptoms can look like fatigue that does not resolve with rest. It can look like brain fog, anxiety, joint pain, and then like this histamine reactivity, so things like flushing, or like if your heart is palpitating, especially after you drink wine. And then if other recurrent infections are happening, yes, it's all interconnected. So here is what makes mold so clinically tricky. The symptoms can be very diffuse. They can look like 20 other diagnoses. The standard of care medical system does not test for mycotoxin exposure. So women end up cycling through specialists, collecting their diagnoses, never addressing this actual environmental driver. So if you live or work in a building that has had water damage, flooding, or visible moisture, and you have unexplained symptoms that do not respond to conventional treatment, mold will definitely be on my differential list until proven otherwise. I will say, I don't go straight after the mold though, okay? If you have a mold exposure, it could have been 15 years ago, and you're kind of having repetitive exposures, okay? Or it walled it off, your body walled it off, and then something happened, and then you started having symptoms, okay? There's a lot of things I think about here, and I won't just jump straight into a mold protocol. So be very careful with that. If you hear, influencers or somebody say, oh yeah, just take this mold protocol, we want to be careful about that because your body might not be ready to process that mold. So, okay, just think through that. Your environment is definitely a control system. We are exposed to so many toxins every single day. If the input is toxic, no amount of supplements or diet changes or medication can get you well. You have to address what you are living inside of. It could be something in your house. It could be things you're putting, cleaning materials, things you're putting on your body. There's so many things that we are exposed to every day, and definitely mold is one of them, and it's actually more common than we are realizing, okay? So, next question. I have lupus. What do you truly believe causes it? And what have you found that actually helps people function? So I love this question. I just did a podcast autoimmunity before the autoimmunity or something. I think I might have called it autoimmune before the autoimmunity, something like that. So I obviously believe that there's some root cause issues related to autoimmunity. So go back and listen to that episode. But I love this question, and I want to just go through this because I'm going to give you some real answers, okay? What I believe causes lupus or rheumatoid or even back up to Hashimoto's, we just talked about that. Any autoimmune, okay, is a perfect storm of several things converging at the same time. It can be our genetic susceptibility, okay? I'm not going to always blame it on the genetics, but there's part of it there, okay? Gut permeability, so what's happening in the gut, remember that? Immune dysregulation, a lot of the immune system is housed in the gut, so all that's interconnected. Even cortisol and the adrenals affect the immune system, okay? So there's that. And there's usually some sort of trigger, okay? It could be some sort of stressor on the system. It could be a viral infection. It could be some sort of history of trauma. It could be that mold exposure we just talked about. It could be a period of extreme physical or psychological stress. The trigger is not the cause, or otherwise a ton of people, more people would have autoimmunity, but it is all that together, and the trigger is like the match. The environment inside the body was already primed for that. Conventional medicine treats lupus as a disease of immune excess, and the treatment is often to suppress the immune response. And I don't disagree with that. Sometimes that's the next best thing. Sometimes suppressing the immune system is needed, or modulating the immune system is needed to help prevent damage. But there are other things we can do. We have to dive deeper in to what is truly underlying causing this. And there are no medications truly that just will help to solve all the root cause associated with this, okay? I do not disagree that immune system is sometimes necessary in active disease, okay? But it does not address the root cause. It manages the fire without asking why the building was flammable, okay? The building caught on fire, why, okay? What I have seen people help people with lupus actually function better, healing the gut permeability, correcting the gut microbiome. The gut is where approximately 70 to 80% of the immune system is regulated. So we have to identify what's happening with the gut immune system. I will talk all day long about that. I think the gut is the primary driver behind so many autoimmune issues. Okay. And then you have to think about food triggers. We have to identify them, try to remove them. It could be gluten, those bigger things, dairy. These are the big, broad categories. But if something is triggering your immune system of your gut, then it is likely going to be causing some autoantibodies. Those get into your blood, and they can cross over and form things like that attack the thyroid or the joints or whatever, okay? So we have to also address that nervous system dysregulation, because stress drives inflammatory cytokines. It all starts affecting cortisol, adrenals, all that gets involved. And then vitamin D is a part of this. Vitamin D is not just something to go get from the sunshine. If I have a patient with autoimmunity, I am optimizing their vitamin D levels, because it is a direct immune modulator. It's not just a bone vitamin. We're not always able to get enough just from our sun exposure. So we are monitoring those levels and getting them well above the normal limits, okay? So we also need to be looking for nutrient depletions that fuel the inflammatory cycle. So it's a big process to look at this. It can feel a little overwhelming, and it's not as easy as just saying, oh yeah, let's put you on this immune modulator. I will say for some people that is the better thing, because at least we're preventing some of that active disease that's occurring. So we want to stop some of that too. It is much harder to help someone with autoimmunity once they are already on immune modulators, but it's not a lost cause, okay? It's never a lost cause. I am not telling you that lupus is reversible in every case. I am telling you that function and quality of life are absolutely improvable when you stop just suppressing the immune system and start addressing that physiology underneath. So I hope that answered that question. If not, let's dive deeper into that. Go back and listen to that previous podcast. Okay, what about this one? Do you believe my cholesterol is hereditary? And could varicose veins be contributing to it going up? So I want to address both pieces here, because they are somewhat related in a way that could surprise you. So let's talk about cholesterol. Yes, there is a diagnosis familial hypercholesterolemia. It's real, but in my clinical experience, the word hereditary, it just gets used far too quickly as a conversation ender. It becomes the reason why nothing else is investigated and why a statin prescription is just sometimes just handed over very easily. But here's what I want you to understand. Probably I should also say before we go on, I'm not necessarily anti-statin, but I'm let's figure it out before we just go straight to the medication, okay? So here's what I want you to understand. Cholesterol is a stress hormone precursor. It is the precursor to every hormone. If you look at a cascade of hormones, what's at the very top? Cholesterol. Cholesterol is going to go up when our other hormones are going down because it's trying to fix it, okay? Many times, once I help someone get their hormones back online and get at more therapeutic levels, the cholesterol will actually come down. So the other thing is cholesterol is such an integral part of our cell membrane. If you want to know more about this in particular, go read my book. I don't remember what chapter it is, probably the chapter on cell health. So I'm going to guess it's chapter 9, I think. Yes. Okay. So when cholesterol goes up, the question I ask is, what is your body repairing? What is it trying to calm down? What hormones is it trying to fix downstream? What is it being stressed by? Elevated cholesterol in the context of inflammation, insulin resistance, hypothyroidism, or chronic stress is your body doing exactly what it is supposed to do. That is not a cholesterol problem. That is a downstream signal issue. Many times I want people to think about this, like, if cholesterol was the entire answer to reducing heart disease and stroke, then we have to think, okay, we're lowering millions of people's cholesterol with statins, which fine, okay, but we are having exponential increase in heart disease and strokes, okay? So it doesn't seem like that's the whole problem. I want you to think about a road surface. If that road surface is irregular and we just go put asphalt over the top of it, then the body is going to lay down more and more asphalt as more potholes develop, right? I'm talking about a road here, but I'm talking about vascular surface. The vascular surface is inflamed. It has potholes. We lay down some plaque. The cholesterol, right? It comes in, lays down some plaque. The problem's not necessarily the cholesterol, right? It is the vascular surface. So we need to be paying attention to the vascular surface. There are specific tests I do for that, but cholesterol is not always the problem. So let's talk about the varicose veins part of this. That is the connection you are putting together. It might not be direct causation, but they are both pointing in that same underlying territory. Varicose veins indicate venous insufficiency, which involves vascular integrity, back to that vascular wall, okay? The connective tissue health and circulatory dynamics, like how everything's going into those veins, okay? Poor venous return, so an inability to get the blood back up the body, it can contribute to inflammatory signaling, and chronic low-grade inflammation is absolutely a driver of elevated cholesterol. So rather than just saying, is it hereditary or am I causing it? I would ask, what is the inflammatory or metabolic environment inside my body right now? That is the real root cause question. And that is the one worth investigating before you accept just a lifetime of lipid-lowering medication, okay? Let's go on to the next question. I started the book and I'm working on the first 7-day challenge. It sounds like she's installing some of the anchors. I am eating within an hour of getting up. Is it better to work on one change for a week or two, maybe one or two, before going to the next one? So, you're doing it exactly right. Whatever you need is the way it needs to be done. And I mean that as a source of encouragement. The reason I structured the book in the way I did is because behavior change that lasts is never about intensity and pushing harder. We have to stop pushing so hard, okay? It is about sequencing and tolerance. What you're doing is called habit layering. You establish one behavior, it becomes automatic, and then you add another one, okay? Your nervous system can actually integrate change this way. And when you pile 10 changes on at once, you create a stress load on your system. You're pushing too hard, and that compliance collapses. And it's not because you lack willpower. It is because your physiology is not designed to absorb that many variables simultaneously. Eating within an hour of waking is not a small change. It resets your cortisol and glucose rhythm. That whole rhythm, stabilize the rhythm for that entire day. give that a couple of weeks if you need to, right? If you feel like it's helping, then it's helping, okay? The sequence matters more than the speed. The goal is not to just implement everything at one time, because again, that creates a lot of strain, can create more nervous system instability, and then everything just goes, I'm not doing any of this anymore, okay? So it's not necessarily to just try to do it all as fast as possible. Do what works for you. Some people can do a couple of habits at the same time. Some people, especially if we have lower resiliency, we do sometimes just need to be focused on one thing at a time. Like it could literally be just focusing on not hitting the snooze button for a week and getting light in the eyes. I mean, it could just be one thing at a time that can really start to reshift that rhythm, the reset portion of that, okay? One real change that sticks beats 10 changes that fall apart in 3 weeks every single time. So keep reading the book, keep going, you're doing great, okay? Okay, next question. I was diagnosed with rheumatoid arthritis and I was told there was no cure. I want to stop the inflammation. I also have liver scarring and fibrosis from arthritis drugs. I would like to reverse that too. So again, autoimmunity, okay? So we've already addressed autoimmunity. There's a previous episode about this as well, but your instinct is right. And I want to validate it fully before I explain why. I just want you to feel validated up to this point, even in this podcast episode, that there is something underlying driving this in almost every situation. The no cure framing in conventional medicine means, honestly, we have no pharmaceutical that eliminates the disease. What it does not mean is that you have no options, that function cannot be improved, or that the underlying drivers cannot be addressed. Those are completely different thoughts. Like all our autoimmunity, RA, lupus, all the things, they all have underlying root causes in most situations. Gut permeability, we've already talked about that. It is one of the most evidence-supported drivers, okay? Molecular mimicry, and that means that there's proteins in foods or there's pathogens that look similar enough to joint tissue that the immune system attacks both sometimes. That's a real and documented mechanism. Then there's microbiome dysbiosis. That's where the good microbiome and the bad microbiome are sometimes not in balance, or there's some overgrowth of the bad microbiome. There are some very key bacteria that are being studied that when they are undergrowing, like in the good, when we think of good, that they are a problem. Like if there's not enough good bacteria, and there's definite bad bacteria that we're seeing in more autoimmune cases, like that's what you see in a comprehensive stool analysis. You'll see some of these autoimmune triggered bacteria. We're seeing that more and more, okay? So the microbiome is a huge part of this. I'm hoping that the medications will start focusing more on the microbiome as well. And even that in general, the conventional system will start seeing the importance of the microbiome. It does appear to be happening, but that research takes a very long time to catch up. So I feel like I'm in front of the curve here. That's why I talk so much about gut health and the microbiome itself. Also, nutrient depletions. If certain micronutrients are not where they need to be, it definitely will create autoimmune issues from immune system issues, because also the microbiome can't be fed appropriately. Then we have to think about nervous system, that chronic stress activation. These are not alternative theories. They are in the peer-reviewed literature. This is an area that so many doctors are a little bit that are not as curious mindset will say there's no evidence-based medicine around this. And I just say, well, I mean, maybe that you haven't researched, but there is evidence to support this. And I will also say there's plenty of evidence in my one-on-one work that this is possible. So that's evidence to me, okay? So let's talk about the liver scarring. I want to be honest with you because you deserve that. Advanced fibrosis has limited reversibility, but the liver has significant regenerative capacity, okay? Especially in the earlier stages. We have to remove that ongoing insult. In your case, it could be things like hepatotoxic medications. It could be alcohol. We have to think about alcohol as a toxin. I don't want to sound judgmental because I do have an occasional alcoholic drink, but I also know I don't feel very good. And then you have to also think it is a toxin. And then sometimes we can add those specific nutritional and herbal hepatoprotective support. They can absolutely support the liver repair and prevent further progression, but we have to be backing off anything that is toxic to the liver, which sometimes if we're supplementing with 20 supplements, that can be toxic to the liver, okay? The liver still has to process all that, okay? This is not a guarantee that everything will just be hunky-dory, but it is a genuine clinical pathway worth pursuing with the right person. And we can talk about that more for sure. I can do another episode about this. But again, autoimmunity has specific drivers. And I will also say that foundations do have to be there. I talk about nutrition. So what are we eating? What are we fueling our body with? Is there a healthy amount of fuel? Are we under fueling? Then we have to look at activity. Are we moving throughout the day? Are we sedentary? Are we overstraining our system doing something with movement? And then stress is a part of this. Remember, stress is not just our jobs and all that. It is our internal stress, our metabolic stress, back up to those environmental toxin stressors, okay? So stress is a part of this. And then sleep is, I always will tell people, if you're not sleeping, it is very hard to get better on so many accounts, okay? So those are the foundations: nutrition, activity, sleep, and stress. These have to be there in a good sequence in order to help this. So the goal will not necessarily just, I'm never going to say, oh yeah, we're just going to cure RA, okay? But the goal is to reduce immune dysregulation. We're going to lower that inflammatory burden, protect the joints, okay? Help the liver function as good as we can, give it an environment that it needs to recover. That is a completely achievable goal. So we don't need to accept that if there's no cure, that nothing can be done, okay? That's not the same thing. The next question: I feel old and look old after I had a full hysterectomy. Can that actually be caused by the hysterectomy, or am I just actually getting old? No, you're not just getting old. I've talked about this numerous times. I hardly ever will tell people that something is because of aging. Okay, we don't have to live that lie anymore. And yes, things happen. I'm not going to say that you can just live forever. I'm not saying that, but I am going to say that we can keep your biological age young as your chronological age is increasing. I will say that, okay? A full hysterectomy that includes removal of the ovaries, that creates what's called surgical menopause. It's a little different from natural menopause because it's abrupt, right? It's gone. The ovaries are that primary production site for estrogen, progesterone, and a meaningful portion of testosterone. And when they're surgically removed, hormone levels drop immediately, not gradually, but immediately. That estrogen drop alone explains a significant portion of what you're experiencing. Estrogen is not just a reproductive hormone. It is active in skin collagen production. It regulates water retention in tissue. It modulates energy metabolism, mitochondrial function, cognitive clarity, and joint health. And when it drops sharply, women often experience accelerated changes in skin texture, the luster of their skin or hair. There's shifts in body composition. There's cognitive fog. There's more fatigue. Even like metabolic stuff starts happening. That weight gain around the belly starts to happen more. Okay, there's this sense of aging. It feels so sudden because it was sudden, okay? And that testosterone piece, it can be really underappreciated because testosterone in women is much more than just sexual health, okay? Testosterone in women supports muscle tone, metabolic rate, what's happening with insulin and blood glucose. It affects libido, it affects confidence and energy. When we lose ovarian testosterone output after surgical menopause, this contributes significantly to feeling physically depleted. This is not inevitable. There's a lot of hormone physiology. It's responding to a surgical event, but hormone replacement therapy, if it's properly prescribed and monitored, particularly I use bioidentical hormone therapy. We address estrogen, progesterone, testosterone. When we look at those together, we can meaningfully reverse what you are experiencing. It's not about just chasing youth, right? I'm not trying to keep someone from, I'm not so like, oh, I'm just going to keep you from dying, right? But it's about restoring that hormonal environment that your cells were designed to function in. So I will just say this is where a lot of people are saying that hormone replacement therapy is just a fad we're going through, but so many women are suffering because of the whole women's health initiative that happened that
2002, so over 20 years ago, women are suffering because that study was so wrong. But it said, oh yeah, get off your hormones because it causes breast cancer. But you have to remember, we have 20 more years of data. That's why there's this huge hormone movement right now, because hormone therapy, now we know that when you are on hormone therapy, when it's appropriately done, appropriately dosed, okay, less breast cancer, less colon cancer, less dementia, less osteoporosis, less cardiovascular disease. The study's there. It shows it, okay? So I'm a firm believer in hormone therapy. And if someone is saying it's just a fad and we're over-prescribing, I really want you to take a look at their credentials, because honestly, they probably can't prescribe hormones, and that's why they're saying that. So also, if someone is saying that you don't need your hormones checked, probably need to find somebody else or have them read a book that's come out recently by like Kelly Casperson or Heather Hirsch or Mary Claire Haber, or those huge hormone guru ladies. They're shifting the pendulum on this so profoundly. It is so important to check hormones. There are very specific things I look at to make sure your hormones are in the right category. This is also where I can talk more about adrenals and DHEA. Our DHEA has to be at appropriate levels as well. So if you've not had a full hormone panel since your surgery, that's the first step. You deserve to know what your control systems are actually doing, and then you deserve a practitioner who will address what they find. Okay? So that's it. That's the questions I got. That's 7 questions. And you probably noticed the theme, and I'm going to name it here. Almost every single one of these questions was a woman saying, I was told something was hereditary, incurable, inevitable, or normal, just aging, right? But I do not believe it. Is there something more? Yes, there is something more. The questions you asked today are the right questions. They are the root cause questions. That's what got me out of conventional medicine, was I kept asking why? Why does this person have this? It didn't make sense to just throw another medication at someone and then not get better. I saw it all the time. I knew something was wrong. I got super curious. I expanded my education, and now I ask why? Okay? That is asking, what is my body actually doing? These are the why questions. Those are the only questions worth asking. And if you found that this episode resonated with you and you want to go deeper, get my book, You Are Not Fine. There's a reason why I said you are not fine, because we say I'm fine all the time. We hear, oh yeah, it's just, you're fine, your labs are fine, you're just aging, you're just getting older. So this book is for that person that's being told they're fine and they still feel terrible, okay? That's what it's for. It walks you through exactly how to read what your body is telling you and what to do with that information. So you can get it at youarenotfine.com. That's where it is. I want to answer any other questions you have. Put them in the review here. Just share this episode with somebody you think that needs it. Put your questions in the review at the bottom of this, and we'll do another episode like this, or reach out to us. What's your questions, okay? Overall, I love answering questions. I love bringing light to the situation. I will say I'm not anti-conventional medicine. I just think there's a different way, a different approach. Okay, so that's what I'm here for. Follow along with us. Please like this podcast, review it, share it, whatever. Help us to grow. And you can also follow us on our Facebook at Dr. Casey Wallace, any of those things. So reach out, look in the show notes. That will have all the information. So thanks for listening.
Thank you for joining me on this episode of the Anchor to Wellness Show. Together, let's anchor ourselves to a life of vibrant well-being. Until next time, take care, stay curious, and embrace the journey to holistic vitality. Stay anchored and stay well.